Module 1, Acute Care, Nurse Assistant. Basic terminology. The basic organizational structure of the acute care hospital. Board of Trustees, Administrator, Nursing Management, Medical Director, Ancillary Services, Management, Business Management, Patient Care, and Unit Leadership. Common lines of authority within the patient care unit. The nurse assistant takes direction from and is responsible to the licensed nurse, who takes direction from and is responsible to the licensed individual immediately above, an LVN to the staff RN to charge nurse or nurse manager to nursing supervisor. Medical specialties. Identify medical specialists. Identify type of care for each specialty. Hospital departments. Define the health team members and their roles. Physician, RN, LVN, CNA, respiratory therapist, patient care technician, housekeeper, unit clerk, occupational therapist, physical therapist, dietitian, pharmacist, speech therapist, social worker, discharge planner, and nursing supervisor. The impact of regulatory agencies on patient care. A. Define the agencies. The Joint Commission of Accreditation of Healthcare Organizations, JCAHO. Department of Health Services, DHS. Hospital Insurance Portability and Accountability Act, HIPAA. B. Review difference in regulatory agencies between acute and long-term care. 1. Department of Consumer Affairs. 2. Board of Registered Nurses. 3. Board of Vocational Nursing and Psychiatric Technicians. 4. Medical Board. Review Occupational Safety and Health Administration (OSHA) requirements. Job description for an acute care nurse assistant. Nursing assistant job description. Nursing assistant duties sample day. Limitations of the nurse assistant role. Hospitals may have acute-care nurse assistants perform skills beyond what the DHS regulations permit long-term care certified nurse assistants to do. There are currently no regulations stating what skills the acute care nurse assistant may or may not perform beyond the regulations for a CNA in long-term care. Facility-specific responsibilities beyond the level of long-term care CNA may necessitate being identified as an acute care nurse assistant and not as a certified nurse assistant. If nurse assistants in acute care perform EKGs, they should not write CNA after their name. If they do, it could result in the DHS taking action against the continuance of their certification because they performed a skill outside of those allowed in their regulation. So, the name badge and signature should not contain the title of CNA if the hospital requires performance of skills beyond the limits of CNA regulations. The possible legal implications of being an acute nurse assistant. Professional, ethical responsibility regardless of setting. Nurse assistants may be asked to witness a legal document by signing their name. Nurse assistants should politely refuse such a request. If a nurse assistant were to witness a legal document, he or she would have to be prepared to testify in a court of law about the individual who asked him or her to witness the document. If a nurse assistant assigned his or her name to witness a will, the nurse assistant must be prepared to testify that the person was of a sound mind when the will was signed and that the will was the person's last will. Hospitals generally have policies regarding employees witnessing such documents. Nurse assistants are to know the policy of the facility. Also, review advanced directives. The importance of maintaining key job skills and personal standards. A. Current basic life support card required by most hospitals. B. Continuing education requirements. There are no regulations requiring continuing education for an acute care nurse assistant, but there are regulations for maintaining the title Certified Nurse Assistant. acute care nurse assistants are important members of the healthcare team. Healthcare information and procedures change quickly. Nurse assistants must attend classes and keep their knowledge and skills current to provide the best care possible to their patients. C. Workplace skills. Personal standards are important, and they include attitude, conduct, attendance, and appearance. Employers want employees who are well-groomed, are dependable, care about others, are considerate, cheerful, courteous, and respectful, and are responsible. D. Annual Safety Review. The role of managed care within the healthcare delivery system. A. Managed care includes the delivery and payment of healthcare. Types of managed care are HMO, Health Maintenance Organization, and PPO, Preferred Provider Organizations. Prospective payment systems limit the amount paid to hospitals by insurance companies, Medicare and Medicaid. Prospectives relates to before care. B. Diagnostic-related groups, or DRGs, are legislated by the U.S. Congress in 1983 to reduce Medicare and Medicaid costs. DRGs consist of specific diagnoses. The length of stay and cost of care has been predetermined for these diagnoses, and the hospital is paid this set amount. C. Impact of government healthcare programs and insurance companies on healthcare services. 1. Decreased length of stay. 2. High acuity of patients. 3. Shift from inpatient to outpatient care. And 4. Staffing by acuity. D. Redesign programs in acute care facilities. 1. Multi-skilling of workers. 2. Team concept. And 3. Important role of nurse assistant in redesign concept. Content 8. Ethical and legal practices with respect to patients' rights, age, and gender, and cultural, social, and ethnic differences. A. Define. Ethics means knowing what is right and what is wrong behavior. It includes morals and making choices or judgments about what should or should not be done. An ethical person behaves in the right way. B. Review legal issues in acute care, including HIPAA, charts and records, communications, and overheard conversations. C. Sexual harassment and misconduct issues. An ethical nurse assistant respects everyone, patients and staff, and treats everyone equally, regardless of age, gender, cultural, social, and ethnic differences. D. Patients' rights. E. Guidelines for ethical decision-making process. Rules of behavior for nurse assistants. Respect each person as an individual. 2. Perform no skill or procedure for which you are not prepared. 3. Take no drugs unless prescribed by a physician. 4. Carry out the directions of the licensed nurse to the best of your ability. 5. Be loyal to your employers and coworkers. 6. Act responsible at all times. 7. Recognize the limits of the nurse assistant role and knowledge base. 8. Keep patient information confidential. 9. Consider the patient's needs to be more important than the nurse assistant's own needs. 10. Do take time for self, for meals and breaks when patients are settled. Also, review discussion of ethical practices. Content 9. Quality assurance and continuous quality improvement activities. When this is done on a continuous basis, and emphasis is placed on improving the quality of care in the future, it is known as continuous quality improvement, CQI, or process improvement, PI. The nurse assistant may be asked to make certain observations, document activities, and contribute to the process. Facilities are regulated, licensed, and accredited. To meet the standards required, the facility must complete certain activities, such as establish standards of care, monitor and evaluate care to see if the standards are being met, and identify problems and solutions or methods of improvement, quality assurance. Content 10. The importance of teamwork and collaboration within the healthcare team. Define team concept. The healthcare team includes a group of workers whose skills and knowledge are directed to the total care of the patient. The goal is to provide quality care. Members of the healthcare team work together to meet the needs of the patient. It is the RN's responsibility to coordinate patient care among team members. The members of a well-functioning team must communicate with each other for effective patient care. Information shared includes what has been done, what needs to be done for the patient, and the patient's response to the treatment. Team member responsibilities. Each member has a specific role to fulfill and a job to carry out. Do not overstep your authority or criticize others. Listen to the instructions of your supervisor and ask questions about your assignment in a way that does not challenge his or her authority. Remember that one's tone of voice or body language can often change the message that is being given. Be prompt in carrying out orders and report any work that you're unable to finish. Be ready to offer help to others and accept help when you need it. Have a cheerful, positive attitude. Extend the same dignity and courtesy to every staff member as is extended to patients. Keep common goals in mind. Module 11. The role of a preceptor. Responsibilities of a preceptor. Welcome, orientation. Work together to establish goals. Identify learning opportunities. Give feedback. Problem solve or conflict resolution. Coaching and resource person. In order for the student to meet his or her learning goals, the preceptor must assume the role of the coach. The preceptor demonstrates specific skills and relates specific information, encourages and supports the transfer and attainment of those skills and information. The basis of this coaching process is feedback. There are two ways to give feedback, formally and informally. Informal feedback is given during or immediately following some behavior, provides support, and can alleviate anxiety. Problems are handled as they occur. People tend to put more trust in informal feedback. Give daily or hourly. Formal feedback is delayed feedback. It's associated with large events like reevaluation time or weekly meetings. It includes documentation of a new employee's status in relationship to his or her job description or performance expectation, and evaluation of progress is made on goals. Guidelines for giving feedback. Person must understand the feedback. Person must acknowledge it. Person must be able to change the behavior involved. Key elements in giving feedback. Focus on behavior rather than the person. Focus feedback on observation rather than opinions. Focus feedback on present situation, not the past. Focus feedback on sharing rather than paternal advice. Consider the needs of the recipient for the feedback more than your own needs. Give only feedback which can be easily absorbed. During formal feedback sessions, ask for and listen to evaluation of progress. Give positive feedback on areas where progress has been made, and use specific examples. Focus on problem solving, key problems, and reviewing priorities. End the meeting with an agreement on the present status of the person's work and set specific goals for the future. Set up the next meeting date, and always follow up. Whenever possible, provide positive feedback. When necessary, provide constructive feedback. Unless an emergency situation arises, avoid giving negative feedback. Content 12. The nurse assistant's responsibility when tasks are delegated. Define. The RN has the legal responsibility of delegating tasks to other team members based on their job description, educational background, competence, and specific state nurse practice acts. The RN and the nurse assistant remain responsible for safe completion of delegated tasks. The nurse assistant has the responsibility to communicate to the RN when an assigned task is new or unfamiliar, the RN's expectations are unclear, necessary resources are not available, and the delegated task is outside his or her position description. Steps of delegation. Determine appropriateness of task. Both parties have responsibility here. The RN must determine if the task is one that can be delegated and if it is within the job description and the ability of the nurse assistant. The nurse assistant must take responsibility for speaking up if he or she is not competent to perform the task. The RN determines the appropriate person to receive the delegated task in the team structure according to work assignments that day. The nurse assistant must indicate if there is adequate time to accomplish the task. The desired outcome and time frame is stated. Effective communication is essential. The nurse must give clear directions as to what needs to be done, why, how soon, and when a report needs to be given back to the RN. The RN should ask the nurse assistant to repeat the instructions given to verify understanding. Authority is given according to the limits of state regulations, practice standards, facility policies, and the training and job description of the nurse assistant. The RN must keep in mind the nurse assistant's skill level, experience, and degree of trust that has developed. A newly trained or float nurse assistant would be more closely supervised than one that the RN has worked with for a long time. The nurse assistant must clarify exactly what is expected. Responsibility is accepted. The RN remains accountable for the safety and adequacy of the nursing care and for patient outcome. But the nurse assistant is responsible to carry out the assignment competently and safely. When the nurse assistant accepts the delegated task, he or she accepts the responsibility to complete the task in the allotted time. The nurse assistant must also ask questions if something occurs that is unusual or outside of the instructions given by the RN when the task was delegated, and recognize and report when there may be potential harm to the patient. Proceed with the tasks only when agreement has been reached and all components clarified. The RN must monitor the progress. The nurse assistant has the responsibility to provide ongoing information. If the patient was to receive a bath before going for a test and the patient refuses, it is the responsibility of the nurse assistant to give that information to the RN in a timely manner. Upon completion of the task, feedback is given and the process evaluated. This may involve documentation of the task, an appraisal of the task by the RN with praise for a job well done, or filling out an occurrence form for an unusual incident. Content 13. Ways to manage time and prioritize tasks. Methods to manage time. Clump similar tasks together. Gather equipment and supplies before starting task. Perform the most important task first. Prioritizing tasks. Work with licensed nurse to decide which tasks should be done first. Maslow's hierarchy of basic needs is useful for prioritizing. The needs necessary for life and survival must be met first. Goals that are aimed at the patient's highest level of well-being and functioning are physical, emotional, social, and spiritual. These goals should reflect health promotion, prevention of health problems, and rehabilitation. Nursing measures should be performed based on the nursing care plan and the established priorities, according to direction by the licensed nurse. Content 14. The role of the nurse assistant in maintaining equipment and supplies. A. Important to check unit stock supplies for all shifts. B. Method of ordering supplies and equipment, such as computer entry, requisitions, etc. C. Stocking patients' rooms. And D. Broken equipment. Content 15. The transport and handling of patients' specimens. Handling of specimens. Assure appropriate labeling of specimens. Use appropriate containers and storage. Pick up, transport, and deliver specimens utilizing standard precautions.